The focus for today's press meet is to apprise our media friends about our 12th August program coming up tomorrow. This is the second such edition under the banner Intensified Media Campaign. We are providing you a press handout, but besides that, not for the press consumption, but I would like to brief you about, very briefly, about lay the background of the HIV and AIDS scenario in our state. Starting with the first case detected in our state, Nagaland, back in 1990. Back then, the ICMR, that is the Indian Council of Medical Research Bureau, had kind of estimated that Nagaland would be having a population of about 2,500 injecting drug users in our society back then in 1990, with a prevalence rate of 50%. Prevalence rate is as the name implies, the prevalence rate of HIV in our society. And for your information, that first case was from the community of injecting drug using community. So as I said, Nagaland was estimated to be having a population of 2,500 with a prevalence rate of 50%. Following that, a formal survey study was done in our state by ICMR in 1994, during which the prevalence rate was found to be 39%. So back then and now, why I'm saying this is also to take inspiration from the fact that the prevalence rate has made a substantial decrease amongst the IDU community today. Today, the prevalence rate in our state stands at 2.5, precisely 2.53. So it has come down from 39% to 2.53 today. Now, in some states, such as Punjab, Assam, HIV transmission, the maximum route of transmission is through the injecting drug community, IDU. But in our state, it's through the sexual route, unsafe sex, through the sexual route. So precisely, it's about 87% of transmission is through the sexual route. Whereas the transmission through the injecting drug use is limited, I would say, to something like 8.6%. So again, I would also like to apprise you of the fact that unlike most of the Northeast states, the trend of HIV transmission is, I would say, more or less stabilized in our state. So to give you data on this, starting from 2020, back then, we had a prevalence rate of 1.39. Today, our prevalence rate is, we stand at 1.37. So we, especially the Nagaland State AIDS Control Society, draws inspiration from these figures. So actually, based a formal study also shows that our population, more than 90% of our population has some degree of knowledge. At a point of time or the other, they have been made aware, especially on the routes of transmission of HIV. However, the 90+ percentage has not really translated into safe behaviors. So Nagaland today stands at number 2 in as much as the prevalence rate is concerned. The number 1 state is Mizoram, followed by Nagaland state. And therefore, the importance of awareness activities cannot be overemphasized here. So coming back to our intensive IAC program tomorrow, it's formally to be launched tomorrow at 11 o'clock, following which activities will start. Similar activities will start in all the districts. And like last year, we look forward and we intend to reach out to all nooks and corners. So therefore, we have targeted altogether 520 villages, 376 schools, 110 colleges, and so forth. So our activities will be, yes, awareness activities, and we will also be having some special activities in the form of flash mobs, in the form of folk performances. So precisely again, folk performances, we will be staging about 100 folk performances with about 50 flash dances. And precisely, our target is for about 5,200 door-to-door campaigns, household visits, which maybe at the end of the day, we look forward to achieving more than our target also. So again, I solicit the full cooperation of our media friends, like in the past, because it is, as we all know, the creation of HIV awareness, the best route is through our media. And therefore, we have called for this press meet with you all today, and looking forward to your extended support in the days to come, starting from tomorrow. Thank you very much.
How many participants are expected, and from which departments or from which part of the society are they invited?
Yes. Again, precisely, we are targeting, of course, we are targeting the general population, but in as much as tomorrow's program is concerned, we are expecting participation of more than 3,500 students from schools and colleges.
Tomorrow is also International Youth Day, 12th August as well.
So this is a national event. So it'll be pan-India, happening on the same day. Yes, please. Yes, campaign starts tomorrow, kicks off tomorrow, 12th of August. It will go on for 2 months till the 12th of October. Tomorrow, the launching will be at the NBCC Hall, Convention Center. Yes.
Nagaland State is part of the campaign, of the nationwide campaign, starting from tomorrow. At the moment, under National AIDS Control Organization, we have 36 state-controlled societies. So across the country, the launching will happen at state level. NACO envisions that through this campaign, we will reach the maximum number of population, maximum number of villages. Last year was the first edition of the campaign from 12th August to 12th October. This year's the second edition. Last year, Pan India, we were able to reach 124,257 villages, out of which, as per your press note, Nagaland contributed 789 villages. So this year, we are trying to cover the uncovered villages of last year. So 520 is what we're targeting this year, villages, where village level meetings will happen, school outreach will happen in that school, and door-to-door campaign in that village will happen. So this is our plan.
I think in our state, we were just working on the data also. Unfortunately, we are seeing a steady decline, but we are still the second highest in the country. That's very worrisome. And another is that we also see the route of transmission. 85% is through the unprotected sexual route. So the infection is happening through unprotected sexual route, 85% of infections among those who are positive, and then about 8% are from infected needle syringe, that is amongst injecting drug users through that route, and then another 5% through an infected parent-child, parents who are not on treatment. If parents are on treatment, then infection to the child is also protected. So that is, those are some of our concerns which needs a collective response, because it's not only to the targeted, we cannot say it's a targeted or marginalized populations that getting the infection, no, because the epidemic is very generalized. At the same time, the sexual route of transmission, unprotected sexual route of transmission is very high. So that's where we all need to come together and make sure that everyone understands the route of transmission and get themselves tested as well.
Is to have no new infections by 2030. As per NACO's data, Nagaland has achieved 37% decrease in new HIV infections since 2010. So somehow the prevalence rate may be, very maybe static or may not be, dropping down so much. But one of our main concerns is also to stop new HIV infections. For those who are living with HIV, treatment, promotion of treatment and services that are provided by the government through our hospitals are promoted. But one of the main objectives is also to reduce new HIV infections. We have achieved around 37% decrease in new infections since 2010. So, that is also one thing that we are looking at, so that the reduction is not just 37%, but by 2030 or by after 5 years, at least the reduction of new infections come down drastically. That is something that we are looking at. And that is why we are intensifying a lot of our campaigns targeted towards the youth.
How many ART centers are currently present in the state, and are there enough to cater to the patients suffering from what?
We have 13 centers in all the districts except the new districts. And what was the other question?
Is there enough to suffice the patients?
For now, district-wise, it is enough for now. We have not increased when we have not asked for increasing the number yet.
And based on the need of the, for example, the PLHIV population of a certain district, when there is a need to enhance the services, we have something called the LAC, Link ART Center, through which we facilitate the treatment, the ART.
So these are we don't open new centers, but the existing health centers like CHC or hospital or even PHC can cater to dispensing medicines, treatment to the patients. So we're not opening new centers, but we're linking to the existing services.
And another thing which I would like to apprise you of is on the lines of what our GD IEC had mentioned. Based on the SDG goals, and under the aegis of NACO, National AIDS Control Organization, the Nagaland NSACS is also working towards achievement of the 395s. The 395s are, the first 95 has to do with all HIV infected people in the society are to know their status. To know their status as in whether they are HIV positive or negative. So that first 95 target, that first 95 population of people knowing their status are to be brought under ART treatment, antiretroviral therapy. So at least 95% of that population are to be brought under treatment. And the third 95 goal is, having brought this 95 under treatment, the goal is for them to achieve the viral suppressed status, where the virus is no longer visible in their blood during investigation. So there is something called U equals to U. So when the virus is no longer detectable in your blood, meaning you will no longer transmit the virus to your sexual partner or your injecting needle sharing partner, and so on and so forth. So the 395s is what we are working on.
Nagaland State AIDS Control Society coming up with an intensive campaign, grading awareness is most important. However, do you find the population, are they coming forward to know their status as part to your grading awareness campaign, especially in the village areas?
Yes, they are. If you just compare, not with data, but if you see the kind of campaigns that we've been carrying since the past 10 years, even say, for example, Hornbill Festival. 10 years ago, we used to really try to motivate people to come for testing in Hornbill Festival area. Last year, we've seen that, without us motivating also, visitors who are working in the Hornbill Festival itself are pulling each other to come forward for testing. So that also shows that somehow the stigma and discrimination is also reducing up to a certain extent. In the villages also, we are mobile vans. We have 12 mobile vans in 12 districts. They carry out outreach activities the whole year round because they've already planned the route from the first month onwards. So the kind of testing that is coming forward through these vans, because these vans and bikes also are meant to reach areas where people cannot come to the hospitals. So the service is taken to the doorstep. So the kind of testing, people coming forward for testing is also increasing. Last year and two years back, we've had 4 performances in 6 priority districts through one agency. They were called not Dreams Unlimited, but Busy Entertainment. Yeah. So the aim was to sort of engage people through folk performance, through skit plays on HIV, and then side by side give counselling and testing services also. So a huge number have turned out in the 6 districts.